Silence your cell phone if you haven't already,
Yeah,
please.
thank you.
We've got 20 minutes before the next one, so this one's gonna be try to get through quick.
Okay.
Good to see you.
Good to see you.
Yeah, what are the ground rules on this?
We're going to ask you a bio, very brief bio. We'll talk about some issues while you're running. We don't guarantee equal time. If you want to rebut anything or respond to something your opponent did say, please be polite, don't speak over them. And we'll get started now. Mary Lou, since you had a chance to be here and relax a little bit, why don't you start, please?
Okay.
Please introduce yourself, your district, a brief description of the district's geography.
Okay, I'm Mary Lou Henrich, and I live in House District 46, where I've lived all my life. It is basically, Stark Street is the northern boundary. It goes down to the county line, which is the Errol Heights, Darlington neighborhood. And then it goes east, it kind of jogs around mostly the 205 freeway, but out in the Lentz area it goes out to about 112th. And then on the west end, it is kind of West Tabor, I guess I would say, and jogs around on 50th and 60th and kind of a square with a little H that goes out for Lentz.
Right. Tell us a little bit about yourself.
I am a nurse, a public health nurse by training, graduated from University of Portland. Worked for Multnomah County for many years. Ended up their deputy director. In that role, we decided to work with OHSU and community and migrant health centers and founded Care Oregon. And so I was the first CEO for 10 years in getting Care Oregon off the ground, which has really grown and expanded. And then I left there and went back to kind of my more public health roots and a little organization called Community Health Partnership that grew into what is now the Oregon Public Health Institute, and did a variety of legislative things at various points. And I don't know if you want me to talk about those now or later.
Just give us a very quick.
I started the first school-based health center at Roosevelt High School in 1985. There's now 70 of those across the state. It was very controversial at the time, is not so anymore. And the thing that probably will have the most lasting impact in Oregon and across the nation are nutrition standards for all the foods and beverages that are sold in public schools. And that law we passed, and actually now Governor Kotek was in her first session or second session of the legislature and worked closely as we stand, basically what people say is we got the sugar-sweetened beverages, the sodas, out of schools and established nutrition standards, and also menu labeling. If you go into a restaurant across the United States, you will see on chains, large chains, you'll see calories, sodium,
So
fat.
that national law came from
from us.
Oh,
Yeah.
okay.
Yeah.
Great. Willie?
Yeah, my name is Willie Choatson. I am a dad to two wonderful toddlers, and I am a former public school teacher, and I am currently a public defender. And
How long did you teach?
I taught for 3 years at the middle school math level, teaching 6th grade math at a public middle school down in Oakland, and then I taught 2 years of undergraduate economics as well. And so started my career teaching from Oregon originally, but started my career teaching down in Oakland, California. Loved teaching, but also saw educational inequity really up close. And I was at a school that was very diverse, and I saw that students already by the time they were 10, 11 years old really had a lot of their future predetermined for them based on their zip code and the race and the income of their families that they were born into. So I went off to law school trying to kind of find more systemic solutions and think about things more at a systems level. Spent a lot of my time in law school doing legal aid work. So I was representing families on evictions and foreclosures, as well as representing employees on wage theft claims when they hadn't been paid properly by their employers. And then, like I said, I was also teaching an undergraduate course to Harvard College students in economics. And then I moved out here to be a public defender back home in Oregon. And I love being a public defender. I really, really love the work I do. But our systems are really struggling right now. And our public defense system, certainly is struggling. Our criminal legal system more broadly is struggling. But as a public defender, I really have a front row seat, I think, into a lot of the intersecting crises that are most urgent facing the community: homelessness, addiction, mental illness, and that public safety piece as well. And so while I love the work I do, I feel like even if I can change one client's life, it's so clear that there's just a wait list of clients, waiting to get our help and come through our doors, and we haven't changed any of the systems. And so that's really what drove me to run is not just how do we fix the public defense crisis or how do we fix the criminal legal system, but how do we actually create a world where we're addressing those root causes of harm, so that we don't have so many clients, so there's not an infinite supply of clients, because we're actually trying to prevent the harm in the community.
How many years have you been a public defender?
I've been a public defender more than 4 years at this point.
And so how often are you in court?
So when I was a kind of a line trial of a public defender, I was in court every single day. I'm now a chief attorney at the office, so I supervise a team of about 15 misdemeanor attorneys. I would say I'm still in court probably 3 to 4 days a week, but less and less so. When I go to court, I'm often observing other attorneys and giving feedback and coaching. I do have my own caseload as well, but a lot of my work now is staffing questions, training, onboarding, and helping kind of combining the teacher side and the public defense side, teaching people how to be a public defender.
So Mary Lou, why do you ran for this seat? It was a different
Yep.
configuration, but you ran for this seat.
In 2006.
18 years, gosh, I can't believe it's 18 years
I
ago.
can't even.
Why are you running this year?
Well, the reason I'm running this time, and I talked about my public health career, then healthcare career, and have seen that it is really the root of many of the problems that you're talking about, Willie. The unaffordability, the lack of access, the fact that we don't have adequate behavioral health in place, that even when we have laws like worked really hard on the Reproductive Health Equity Act, and then years later as it's the DCBS audits it and finds out that insurance companies really aren't doing what we said they should be doing, what the law said. Lots of reasons that were given, et cetera. So right now, healthcare is unaffordable, chaotic, and just out of reach and causing tremendous medical debt for people. And I'm sure you see this. Mm-hmm. And so they end up in this endless place of never being able to get ahead. And it is, I feel proud about the Oregon Health Plan and what it's done for so many people. But still, we have this insurance employer-based, the government paying for a lot of health care, and overall it's causing economic hardship, not just on individuals, but on businesses.
So are you an advocate of single payer?
Yes, I am.
And do you think Oregon can really afford that?
Well, I think that we can't afford not to do it, actually. The Senate Bill 770 task force that was chaired by Dr. Bruce Goldberg came out with the report showing that the smart actuaries looked at the whole mess and said, if we just keep going like we are, in 2026 we'll spend $52 billion in this state for healthcare in the mess we're in, with some people covered and others not, all of this. And if we went to a single payer system, it would cost $51.2 billion, and we would cover everybody, and it would be equitable and fair. So we, from there, went into work to get Senate Bill 1089 passed, which now has the governance board that is just beginning its work. Its first meeting will be April 16th. And that board will be delving into the complexities. This is not easy. Mm-hmm. Will it happen in my lifetime? I'm going to sure give it the try, but it may be that it'll take longer. But my grandchildren, your children, are going to be saddled with a mess that isn't even meeting people's needs. So anyway, I'm trying.
Same question for you. Why are you running?
Yeah, I'm running, I think, not just to solve the public defense crisis, but really to address those root causes of harm. And I think we can do so in 4 ways. Expanding access to treatment, creating more affordable housing, which I think is the #1 solution to our homelessness crisis, improving traffic safety and the walkability and public transit in our neighborhoods, and then also investing in education, specifically early childhood education, but as well as K-12 education, apprenticeship programs, and workforce development. I think if we got those 4 things right, then we wouldn't see nearly as much harm in the community. I wouldn't see nearly as many of the clients that I see today. And what I see is that these crises that are all intersecting, and it's what I hear at the doors. I hear homelessness, I hear safety, I hear services. I'm sure you're hearing the same things. We don't have a lot of legislators we don't have any legislators who bring public defense experience, or at least ran as a public defender. But we don't have a lot of legislators who have that hands-on experience trying to get folks into treatment, but knowing that the treatment wait lists are 3 or 4 months, or having to give that advice, show up every single day for a week to show them that you're serious, right? The on-ramp to recovery shouldn't be that steep. Same thing with homelessness and trying to get folks into shelters and trying to get folks into housing and having those conversations. There's just not those resources out there. So I think my on-the-ground experience working in homelessness and addiction and mental illness is really missing in the legislature. I think that's a really needed voice right now. And I think those are the crises that in this specific moment are the most urgent crises. Those are the areas, I agree with you on single payer, and I think we need to improve our healthcare system, but we're last in the country in access to treatment. We are one of the bottom 2 or 3 states in the entire country in unsheltered homelessness rates, right? We have these urgent problems. And I think we need people with that on-the-ground experience, because that's an understanding of the complexity of the problems, the urgency of needing to find those solutions, and also what ideas are more likely to really work than others.
So your opponent has worked in various facets of healthcare for decades, and, and you've worked for 4 years as a public defender, so shouldn't we pick her because she's got a lot more experience?
I don't think that's the way that we should measure experience. I have deep respect for your experience and for your campaign. But I think that what we should look for is what experience do we need in this specific moment, right? Voters aren't deciding who is a good candidate. We're both good candidates. They're picking somebody for this specific moment in time and trying to solve the issues of this moment. And I think the last 4 years were really crucial 4 years for safety, for the criminal system, for the public defense crisis, for homelessness, for addiction. And I think I bring more on the ground. What does that look like today, right? What it looked like 20 years ago is less relevant than in a mid-pandemic and post-pandemic Portland. What does our downtown look like? Why are people feeling unsafe? How do we get to the root causes of the fentanyl epidemic or things like that? So I think experience is crucial. I think we should absolutely value experience when we choose elected leaders. I think I bring experience that is actively missing from the legislature right now.
Do you want to respond to that?
Yeah, I would respond that many of the things that you're talking about really have been going on and been growing, and people have been working at pieces of it. But that comprehensive piece, that's kind of the social determinants of health. That's what public health is all about. That's what I'm grounded in. And I've had people at the door say to me, your opponent and you have similar values. And I say, yes, we do. But I had a young person say to me the day, I've kind of changed the way I'm thinking about it. I'm looking for somebody who has a proven record of getting things done. And I think that I do bring that proven record of, experience in how do you get a group of people around a thing like a school-based health center that's going to provide contraception in a high school. In 1985, this was like, oh my God, but we had a teen pregnancy problem. How do we approach it? And we brought the people together and got this thing going. And now there are 70 of them across the state. So I think I have various experiences that do show that I know how to bring people together and get something done. And that's what I think I bring, years of it.
So if you were to be elected, I'd like both of you to tell me which committee you would like to be on. If you only could, you'll be on many, but if you could only be on one, which would the committee be and why? We'll start with you.
Absolutely. The Judiciary Committee is absolutely where I think my skills.
I'm sorry?
Judiciary Committee. I think that's where my skill set is most needed. I'm not going to say that lawyers are underrepresented in the legislature, but it is about the fewest lawyers I think that our legislature has had for a long time. And we're making decisions about a court system that right now is really struggling with capacity. We're making decisions about a public defense crisis where that's not serving our community as a whole in terms of public safety, nor are we honoring the constitutional rights of the people who are living here. And beyond that, I think we don't have somebody with that legal aid background and with that public defense background currently in the legislature. So that's more than just criminal systems, that's expanding access to justice, that's making sure that our justice systems are really serving the entire people.
Okay, same question for you, Mary Lou.
Well, of course, I'm going to say Behavioral Health and Healthcare House Committee, where there are 7 lawyers in the legislature already. There's only 1 nurse, and that's Travis Nelson. And Travis and I have been working together advocating for change in behavioral health and health care. So I think that's the broad place where those bills will come forward, and we will bring them forward. So
So I want to ask you, we've been hearing from various visitors. We heard from a professor at OHSU who said, look, we spend about the median in this country on behavioral health all in, but our access is 49th or 50th. So money isn't the problem, at least according to him. I don't know if you subscribe to that, but we seem to have we seem to have adequate funding, but the funding doesn't translate into access to care. First of all, do you agree with that?
I don't know that I agree with that.
Okay.
I think that throwing money at something isn't always the answer. So I do think you need to get to what is our system. And having worked for the county back a ways, one of the issues was when the state hospitals were closed, and the dream or the promise was that there would be money for community mental health. It never really transpired. And so the most chronically ill were left to roam the streets. And then when the Oregon Health Plan came in, we have, the people with, in the old days, the neuroses, but they aren't the psychoses. And the fact that the counties, the money that had been going to counties for mental health was all of a sudden shifting over to the managed care organizations. And anyway, the system is a mess. And I think that there needs to be the counties together. There also is a lot of competitiveness. One of the things that Portland Street Response, when it got brought in, great idea, but it didn't connect. It wasn't a county. The county had the mental health responsibility. So it's not just quite so simple, and I haven't really thought about it in the way he's saying it, but I don't totally agree with that.
I'd like to give you each the opportunity to ask your opponent a question, make it a question, not a statement. And the idea here is to try and draw some contrast. Mary Lou will give you a chance to go first.
Okay. How do you feel that you represent House District 46 when you're really a relatively new person to the district? And how will you connect with the diverse population?
Yeah, I appreciate the question, Mary Lou. I've lived in the House District about 4 years, but I'm from Oregon originally, and I moved around a lot. My wife moved around a lot. When I was graduating from law school, we had a really deep conversation about where do we want to set down our roots? How do we want to provide a life for our kids where there's a sense of stability and they know their neighbors and they grew up with their neighbors. So House District 46 is the first place I ever bought a home. It's where both of my kids have been born. It's where we send our kids to daycare. It's where our kids will go to public school. And I think that having a family and raising a family, as you know, really puts your roots down in a community. You know when that swing set is broken. You know where those sidewalks don't work because you can't push your stroller there. And so I think that is essential, right, in terms of understanding the community now, right? We live right across the street from a park. Neighbors come by and they knock on our door to borrow, to use our bathroom or to borrow something, because that's the kind of community feel that we have in Brentwood, Darlington. But beyond that, I think that knowing that our kids are going to grow up in these public schools, that these are the streets they're going to be walking, and that we want to have a safe community where they can walk themselves to school when they reach that age where that's appropriate. That's a real investment in the community. And I think that my endorsements really show the type of collaboration that I'm looking to do. So groups like Apano with deep, deep roots in House District 46 and their headquarters in House District 46 have endorsed my campaign. Groups like Paccoon advocating for the Latinx population. As I've continued to meet more and more voters, I think that voters are really hungry for people with the hands-on experience with homelessness, addiction, and mental illness that I can bring.
So question for your opponent, please.
Yeah, I guess my question would be, what in the last few years is the work that you feel like has prepared you for the current crises of today and how they may have changed over the past? few decades?
Well, for about the last 6 years, I've been a board member of Healthcare for All Oregon. So really a deep dive into Healthcare for All Oregon is the lead advocacy organization for really fixing the healthcare system. So I have a lot of budget experience, I have a lot of legislative experience, a lot of communications experience, and I actually filled in as the interim executive director this past year when we were going through a little bit of change. So I think that that has kept me, on the ground. I worked heavily on getting Senate Bill 770 passed and Senate Bill 1089, also the corporatization of medical care that did not make it out of this short session, but I was very involved in the fact that we have private equity and have got big United Health Plan, all of those coming in. I also worked on the, and actually was part of the beginning thought for the merger and acquisitions law, that I believe Oregon is the only state that has this law that really requires when healthcare people who own healthcare are going to do $1 million deal or more, and $1 million in healthcare is nothing, that it gets looked at, and some things have gotten stopped. So-
Great. We're almost out of time. How old will each of you be on May 1st, just factually, so when we write our endorsements, we have everybody's numbers? We're almost done.
What's
How
the question?
old will you be on May 1st?
I will be 76.
Okay. Willie, how old will you be?
I will have just turned 33.
Okay. If a movie were to be made about your lives, each of you individually, not the same movie, who would play you? Mary Lou, you first.
Meryl Streep.
And Willie?
Lin-Manuel Miranda.
Very good answers. We want to get photos of both of you. We'll have a photographer out this way. I'm sorry to do this so quickly, but we are out of time. Great to meet both of you. Great, nice